Mag-ipon ng tama? Check. Makatipid? Check. Pagkaroon ng tamang investments? Check. Makatulong sa kapwa? Check. Makatravel around the world ng libre? Check. Posible ang lahat ng yan sa IMG. Tuloy-tuloy lang tayo sa pagtulong at pag-abot ng ating mga pangarap. Sama-sama tayo sa 30M by 30 Agenda.
Dear Nay, Tay, kaibigan, handa ka na ba? Handa ka na ba sa mga biglang hamon ng buhay? Hamon ng buhay sa iyo at sa iyong pamilya. Alam niyo, life is full of surprises. Kailangan maging matalino, wais at madiskarte tayo sa buhay. Lalo na kung ang pamilya natin ang nakasalalay sa lahat ng mga bagay na ating ginagawa. Nay, Tay, kaibigan, ang Manila Bankers Assurance ay tutulong sa iyo para ikaw ay laging handa sa lahat ng hamon sa buhay, in all of life's uncertainties, ika nga. Kaya naman, why don't you show your love by protecting your family today? Narito kami para sa iyo. Gagabayan ka namin, laging handang magbigay ng aming pagmamahal. This is our love letter to you. Nagmamahal, Manila Bankers Assurance.
Happy Tuesday morning, everyone, and welcome to another episode sa atong Open Line News Media Forum sa My TV Cebu. I'm Angie Sanyal. And today, lain na sa atong mga hisgutanan alang sa atong forum, mga kauban. To join us, you may send your questions, your comments sa atong social media platforms. You can watch us live now through Facebook or their YouTube channel. And also, you can check our different social media platforms, Instagram and also TikTok for our other postings. O karong buntaga, mga kauban, I am joined by my partner, Eliza Piñaranda. Good morning, Eli.
Good morning, Angie. I'm so happy to be here in Open Line. This is my first time.
And karong adlaw, Eli, daghang tag mga hilisgutan. And for the past weeks, nagisgota sa lain-lain nga mga services na nagkadaiya nga mga government offices. And today, mga kauban, natay mga makauban, una from the province of Cebu and also gikan sab sa Dakbayan sa Lapu-Lapu. So si Eliza, ang mapailaila kinsang ato ang mga guest for today's episode.
Okay, so ang ato ang mga guest, but before we open, actually, Open Line is open for all callers. So our first guest is Sir Michael Espinosa, Accreditation and Statistics, Lapu-Lapu City Tourism Office, and Dr. Vincent Jess Eduardo Montejo, Lapu-Lapu City Health Office. Hi, sir. And Dennis Pastor, the head of Cebu Province Disaster Risk and Reduction Management Office. Hi, Sir Pastor.
So sila ito makauban karong buntaga. To start our forum, ato sang pasalamatan ang atong presenter for today's program. Atong pasalamatan ng Manila Bankers Insurance, Thank You International Marketing Group, Kaiser International Health Group Incorporated, Kaiser Medical Center, Delos Reyes Optical, and of course, atong venue sponsor for today, Waterfront Hotel and Casino. So sa pagsugod nato, di lang ko mong palayo. Ako nga nahon si Sir Dennis here, mga kauban from, again, the Provincial Disaster Risk Reduction and Management Office. Sir Dennis, maing buntag, and welcome to Open Line.
Good morning, Liza. Good morning, Angie. Good morning also to the viewers for this Open Line forum.
So, sugdan siguro na ito pagpaila-ila. Atong kaugalingon sa atong mga viewers, to those nga wala kay baw sa atong background before we enter public service, sir.
Okay. I am a former military officer. I graduated Philippine Military Academy in 1992. I retired in February 1, 2025, just this year. And I'm an Army officer. I've served as an infantry officer all over the country. And my last stint was at headquarters, and before that I was the Philippine Defense Attaché to the Russian Federation, and then stayed in Moscow, Russia for 3 years, more than 3 years.
And with this experience, sir, unsay mapaabot sa mga Sugbuanon nga butang or ma-instill nato with the Provincial Disaster Risk Reduction and Management Office?
Another qualification I would like to mention is I graduated from the Asian Institute of Management in Masters in Disaster Risk and Crisis Management. So before assuming this post, but I graduated in July 6. So your questions is really about inculcating among the Cebuanos the knowledge of disaster risk management. There are frameworks in disaster risk management that can be localized down to the community, down to the family, down to the schools. Manay among effort for this for the rest of the year, for this month. And right now we are still building up their capability in terms of disaster risk preparedness.
For the initial months, sir, in office, unsay mga nakita nato nga kinahanglan jud kayo ma-address when it comes to disaster preparedness, mitigation, and response din sa probinsya?
Right now, we're building up our capability. We are establishing a command center. We have to procure a lot of equipments for search and rescue. As the guidance of the governor, we have also to get an sea and air ambulance. And one of the trust of the governor is to establish forward support warehouses for relief goods to preposition in times of emergencies and disaster. This will be in North Cebu and one in South Cebu. So this is basically a facility to store, preposition or stockpile relief goods.
So gamito na to, sir, mga existing nato nga mga buildings or plano ani magpahimo og gyud laing infrastructure, sir?
For the stockpiling warehouse, we should be building it. So I already talked to one of the mayors, and he will be accommodating such a lot for us. And I'm still going to have to talk local executives down in the south for this facility. For the command center, we have a facility down in Busay, na pwede na to gamitan. For next time, siguro you'll be visiting that when we have established it. It's a command center for situational awareness and decision making in terms of responding.
Nakabisita na ba sadta, sir, sa mga areas dinhi sa Cebu, mga flood-prone and also landslide-prone areas?
Yes, nabisita na nato, but I also visited before assuming the post. I also visited the one in Danao, no? So Danao City. So we visited some of the places, but based on our hazard maps, we really can identify which are landslide prone, which are flood prone, and basically in the months of September down to December, our next hazard or potential hazard is the typhoon.
With this, sir, nakahisgot na tamang kauban nun ay mga equipment and also mga personnel for response. And we know di magkaigo ang pondo, sir, sa probinsya, but I think this move nga mahimog yung department CPDRMO is a great help for the disaster response sa ato, sir.
Yes, a lot of advantages. When it's a department, you have a organization that has the capable manpower to address. Right now, because it's an office, it's limited in terms of manpower. So when it becomes a department, we can hire people with expertise, with the corresponding salary or compensation with that kind of skills and expertise. So we will be going to that. I've already talked with the sponsor for this, board member Celestine Martinez, and he's sponsoring the bill the ordinance to make it a department. Hopefully, sooner.
But karon sir, no, we've heard earlier gikan nimo nga you are starting the capital is starting to hire mga responders na. So kumusta ni sir? Because I believe sa last interview with the media murag tulo pa yung responder sa Kapitolyo.
Yeah, right now we hired 20, but half of these are still the responders, and the responders are continuing to train. We've been training them, so it's a continuous training. The rest, the other 10 out of the 20 will be more on the office, who will address our research, our training, our operations, and our admin functions.
Yes, Sir Pastor. So, I just want to have a visualization sa kaning command center, Sir, baog sa pag-build ani, especially nga sa province, dako kay mong area of responsibility. Unsay mga challenges ninyo o unsay dapat buhaton na para there is also a sense of urgency, good sir, sa inyong department.
Right now, when I assume there's no command center, yun ang problema. So there's a facility down up in Busay that has been left idle. So we are starting to clean it, and we are in the procuring process of getting the equipment, monitors, lot of early warning. So basically, if you're asking what's the command center, it's more on the situational awareness. You see what's happening, and another part is the response and the operations, which will what you see, what's been done, real time, and the other about the command center is what are your resources that you can deploy during times of emergencies and disasters. Basically, that's a command center. It takes note of what is the situation during disasters and during peacetime, that the governor, who is the chair of the council, the Provincial Disaster Risk Reduction Council, will be able to decide what kind of resources to deploy with available resources. So if we can establish that, I hope sooner, because the urgency is there. We have typhoons coming, forecast. So we have a lot of things to be done, a lot of things to be fixed, and a lot of things to improve.
Sir, while waiting nga mahimo tang department, I understand kung mo visit sa Capitol, makeshift pa man ang office gihapon sa PDRMO until now. So, unsay move ani ni Gov?
Right now, after we have established the command center up in Busay, it's still a provincial property. It's you can go direct to this military installation down in the Camp Lapu-Lapu. There's a road there. So right now we are building it. If we can build that, we can transfer there. Then we have a good office. And while we can still maintain a office down in Capitol, maybe the main building just for the admin part of the operations. But if you can move up, the sooner the better.
To add lang siguro sa equipment, sir, I think naghimo naman tag inventory sa current nato nga equipment. Unsa ba ka andam ang probinsya Simbako lang karon kung naay ulan kalit or bagyo, sir, andam mo jud mo respond or dako pa kay tagkakuwang?
We can respond on what we have right now. But still a lot of things to be procured, a lot of things to purchase. Like if we have floods, we need flood boats. But communication-wise, we need also. We've been doing that. So if you are asking prepared, yes, we can respond on what we have right now. But we have to realize it's our years of neglect. Nothing was done to improve it. So with the Governor Pam Baricuatro, he made this an order, a marching order to improve it, to make it disaster ready for any kind of eventuality, any kind of incident, or any kind of hazard that can come to Cebu. So we're doing our best as fast as we can, but the challenge is still there. We have a procurement process that is very that we have to abide with.
Ako lang po di-add, sir. Before sa last administration, we know nga ang PDRMO kay department naman sudto siya. And ang usa sa ilang gihimo nga pamaagi, sir, is the clustering of LDRMOs. Imo ba ning ipadayon, Sir Pastor, or nakailaing idea on how to do about responding to certain hazards din sa province?
Actually, the cluster still exists. on their own. Right now, the officers of the League of DRMOs paid a courtesy call to Governor Pam and Baricuatro, and they were able to raise their concerns that brought to the attention of the governor. So we just improved that cluster, capacitize its capability, and make it work. We have good LDRMOs, by the way. We have good LDRMOs. They're very motivated, and some are still. We need also to capacitate some local LGUs.
You've also mentioned sa other interviews, Sir Kaning, plans na to of having insurance for responders by this month. Kumusta ni, Sir?
We're just finalizing the list. Last night or yesterday, I went into the list. It's about 880 responders for the whole of province. So we have to insure them. So last week during the response in Nueva Ecija, one responder died. Yeah, so that's very sad. So moro siguro atong mahatag sa mga responders because these are who gets into the hazard when everybody is getting out, di ba? I even told them when I was in the military service, my heroes are my soldiers, but right now, my heroes are my responders.
So kani, Sir, no, di siya limited to capital responders, but province-wide.
Oh, province-wide. We have get the list from all municipalities. I hope we can finalize it and get into the bidding. So just the insurance for them in case of an eventuality that is not favorable.
Before we proceed sa health, last siguro for me, Sir, we've talked about response, no? Ano po sa mitigation, Sir? Kaya medyo kitang tanan, even ang mga nagtanaw nato, mga sugbuan nun, medyo lisod pa ang pagpatuman sa disiplina. What's yung plans nato for the mitigation part?
I just want to inform everybody that there are two types of climate adaptation and climate mitigation. So when we talk about climate adaptation, these are initiatives to address the effects of intense or extreme weather events. So when we talk about storm surge, the mitigation and the adaptation is maybe mangrove. Now, in terms of flooding, the mitigation is you build clean your canals. So these are activities. But when you talk about mitigation, these are initiatives to address the thinning of the ozone layer. So what are these? Electronic vehicle, solar power. So basically these are different kinds of, and there's a need to really make everybody understand difference of the two definitions so that we know what we are going to do.
I actually want to, I'm also curious, Sir, ba, about our behavior jud as citizens. Unsa lay kanang pwede na mo ma-improve sa kaning especially sa disaster preparedness?
The next phase of, no, it's not the next phase, it's a simultaneous approach. First is to prepare ourselves in terms of the office, in terms of its capability to respond. Another simultaneous effort or initiative is what I call community-based disaster risk management, meaning the community should understand the risk, how to respond to the risk, and how to transfer the risk. So this should be inculcated into the community. When the community knows this, it's like localizing the United Nations Sendai framework and doing it in the communities. When you know the community knows how to respond, meaning he understands his risk. Importante kasabot siya sa iyong risk. Akong risk is landslide, akong risk is flooding, akong risk is storm surges. He knows how to respond to this risk. Community-based, that's our next approach. So I'll be talking with some NGOs that can help us. Maybe on 14 na ako with a scheduled talk with Ramon Aboiti's Foundation. They are very active in climate resilience and disaster resilience. So they know how to organize the communities. So mine is just how to facilitate it, but it's really the approach. We should localize DRM. Kasabot ang tao, what is DRM basically?
Kabantay jud ko sa Capital lately, sir, no, na ang keyword na community-based, not only just it, dili lang di ay sa tourism, but also in disaster risk po di ay. So we need to be proactive.
As the governor say, you have to empower communities. And one way to empower communities is to make themselves disaster ready. Community mismo. Because we have seen it. Do you know that you are aware that when after a disaster, rehabilitation part, you know how long the support of construction material comes? 7 months to 1 year. What will you do if you're a victim on the day after the disaster? If the community knows to respond to this, it will be better off for everybody and the government.
Thank you, sir.
Last na gid sir. Kuan na lang siguro sir. You've shared gani imong mga experiences pod when it comes to this. Unsa lang mga best practices outside the country o diri sa other parts of the Philippines na might as well be implemented in Cebu?
Oh, when I took up the masters in disaster risk management at the Asian Institute of Makati, management in Makati, the best practices are in the ASEAN perspective. Also in Asia, there are a lot of best practices in Japan. These best practices when they were hit by a tsunami. So the best practice is to like to narrate to the people, to understand the people what to do. So it's like need siya ng mga programs, but there is sa Pilipinas when we are always been hit by typhoons, a lot of best practices. It's really like learning from it and executing what can be done to solve it.
Thank you, kaayo, Sir Pastor. Later, atong mga kaubanan sa media here can ask their questions sa ato ang first nga guest. And also sa atong viewers, pwede mo makasend sa inyong questions and comments through our Facebook and YouTube Live karong mga higayuna. From the province, ato na punta sa Dakbayan, sa Lapu-Lapu, Eliza. Atay kauban karon ang mga representative from the health nga sector and also sa tourism. So, unahon nato si Dr. Vincent Jess Montejo. Sir, Doc, good morning. Welcome to Open Line.
Good morning. Thank you for having me.
Sir, una natong pangutana is mahitungod lang gid sa mga sakit karon ting-uwan na sir kani ang leptospirosis, ang dengue ug uban pa. Kumusta man ang monitoring nato diha sa Lapu-Lapu City?
Okay, so I can only speak in behalf of Lapu-Lapu City in terms of our numbers of cases. Let me start first with the year-round problem that is dengue. That is what we call an endemic disease, so present all throughout the year, not just rainy season, but predominantly we do find it in the rainy season because more catch basins of water, more places where the vector, ang atong lamok, na ay more chances of them reproducing in these waters. So for dengue, for this latest morbidity week na to, our dengue cases is already at 448 for Lapu-Lapu City. In contrast to last year, we had around 331 if I'm not mistaken. And although that may sound like we have more cases compared to last year, we have to contrast it not just the year prior but also the years before. In dengue manggod, we do see a pattern of spike yun in cases every 3 years. The last spike was in 2022 when around the same time this year, we had already 1,234 cases. That's really a lot compared to the 448 that we have now. Not to discount the fact na daghan gyapon tag kaso, but this year was supposed to be also the spike nga year nga atong gina-expect. So we do see the fruits of the efforts that our field staff and also in coordination with Lapu-Lapu City, with the support of our administration, nakahigayon gyud ta nga medyo na-control gyud atong cases. More cases compared last year, but again, to contrast it with the previous years, today, this year was supposed to be a spike year, but we only tallied 448 cases. And ang pinaka-importante mga galanitanan is we don't have mortalities related to it. But to be transparent, we've only had 1 death so far. Far cry from the daghan kaayo nga deaths nato pag 2022. So moving on from dengue, we also have hand-foot-mouth disease. We also have mpox, leptospirosis, among others, typhoid fever, especially sa mga flood-prone areas nato sa Lapu-Lapu. So from Lapu-Lapu City Health Office, we have been constantly reminding our health staff in the field to screen or kind of spread information regarding the services that we can offer in the barangay health centers. So for example, karon nga problem gyud sa Sigigbaha, leptospirosis is a very strong problem na if you just do prophylaxis or post-exposure nimo gikan sa baha, you take some medications already, it will protect you later on from possible complications sa imuhang atay and imong kidney. So that's why we're reminding them if they have been exposed to floodwaters to go to their nearest health center, and then we will prescribe, and if the medication is available in the health center, we will be providing them with these doxycycline, which is a antibiotic commonly given to post-exposure as post-exposure prophylaxis for patients who have been exposed to floodwaters.
Di na sila kinahanglan magpaabot nga na ay symptoms ubon sa padiha, Doc.
Yes, because the problem with leptospirosis, it will become what we call Wales disease, W-E-I-L. It's a late complication that you have from leptospirosis. And ang problem man gud sa leptospirosis, you may not have a very evident nga samad sa imong tiil or lower extremities. But the thing is, you can have micro wounds or breaks in your skin, which can still be the point of access aning kagaw. So if you get it, you will be mostly asymptomatic from the course of the disease. Diha na siya mag-manifest if severe na. No, especially if repeated exposures ka. Namantay tier na to mild, moderate, and severe nga murag exposure na to sa floodwaters. So if you're mild to moderate, you really advise na to seek consult sa nearest health center, because all of our health centers in Lapu-Lapu City, they have a designated medical officer also. So apil na po ni sa mo ang task by our city health officer, Dr. Reyes, to inculcate in our staff nga kung daghan og risk factors ni nga patient, just give the medication kay this would bawi on later on kay pang ICU gyud nga admission or hospital stay ang kanang Wales disease, which is a severe form of your leptospirosis.
So mo na sayop din yung pagtuo, sir, no, nga katurang na klaro visible nga samad ang posibleng mataptan sa leptospirosis.
And no, we really need to do more of preventive measures.
Yes. Pero sa monitoring nato, sir, kumusta? Wala ba tay mga cases nga daghan ani karon sa Lapu-Lapu?
So, based on our latest data from the city epidemiology surveillance unit nato sa CESU, we have not tallied confirmed leptospirosis case. We had probable, but upon testing, negative ang ilang IgM and IgG, which is a confirmatory testing to see if the patient has leptospirosis. Naray mga patient nag-manifest og symptoms, but these symptoms are not case-specific man good. So they can some people with acute gastroenteritis can also present with fever and then body malaise. So non-specific man good. So yeah. So leptospirosis-wise, we don't have confirmed cases.
Is it because, sir, gamay pa ang magpa-check sa ato mga health centers, or tungod nga medyo improved na sad ang ato ang area sa Lapu-Lapu?
So I have personally prescribed patients who have been exposed to floodwaters with the antibiotic, but I think it's also a play between both of what you said. People are now more aware of the services that are available in the center, so mas voluntary na sila moadto. At the same time, I think other people also are opting to have the services done in private facilities or hospitals. So sometimes when we do the surveillance nato, the hospital data sometimes delay nato on time maget because we have to coordinate pa with them. But so far, we don't have cases remaining.
Karon pud nga start ang klase na kahisgot kag hand, foot and mouth disease, sir. Nakitaan ba nato ang trend nga increasing or wala ra kaayo?
So your hand, foot, mouth disease, just a little bit of info to our viewers. No, it's a very infectious and a very easily communicable disease. It's one of the notifiable diseases of the Department of Health. It's commonly found in children. Makita nato ni sa mga daycare or kanang areas of exposure kung asa na ay crowding. So daycare centers, schools, especially in our public schools, here in the Philippines. So ang kanindot lang gyud aning hand foot mouth disease, it's a mild and self-limiting nga illness. Pasabot, when you get afflicted, time will just heal you, no? Ang ato lang ani is mainly supportive. So if you're having secondary bacterial infections, we can prescribe oral and topical antibiotics. If you're having a fever, antipyretics, etc. So mainly ang atong kuan is more on monitoring and isolation of cases. Kung asa naami ma-identify nga clustering, matik yun na mo stay at home lang sa. So mag-isolation ang individual and then ato i-disseminate ang info sa local school or barangay kay para ma-monitor yun ang cases. So buyag lang yun, it's really more about hygiene yun ang pagpugsaan ng HFMD. And this is a problem that is also kind of year-round. Naaray spike of cases, especially kung ting klase, no? Because other people might say nga, kuan ra ni, contact dermatitis sa panit or naaray kagid. But once you manifest already with kaning mga butoy-butoy sa kamot, sa tiil, and then naapod kay mga luas sa bakba, you already manifest majority of the symptoms for your hand, foot, and mouth disease. And once identified, advice lang nato sa ato mga viewers to seek consultation with your nearest health center. And then, it's just a self-limiting disease, so coordinate lang mo sa ato ang staff kay para dili rapod. So, dapat mag-module ang bata kay para dili maka-miss out sa school. But at the same time, need yun na to ikuan ang info nga they really have to isolate at least for 1 week or until ma-resolve tanan ang iyahang lesions. Kay once wala na kuan sa panit, they are non-infectious already.
But unsa na sir, if sa household na yung mga igsoon, dapat layo gyud gihapon sila?
So the advice there is if ang hand foot mouth disease manggod, although you are asymptomatic, you can also still be a carrier. The thing is, atong pediatric patients, mga kabataan, ang kasagaran maigo. They are the ones that manifest the disease. However, kitang mga adults actually can be the carriers. We do not manifest it. There are rare instances that age group na to, adults going forward, magka-manifest ani, especially if immunocompromised or nailain mga sakit ang patient. However, mainly good about a good portion of these patients, mga pedia lang yun. In terms sa question ni mo, ma'am, regarding sa household, we do advise them nga there is no need for isolation yun nga from room to room. However, important lang yun nga frequent hand washing, hygiene should be implemented kay we're carriers manggod. So if you do frequent hand washing, there's no need for you to isolate manggod kay mapilay na inyong household if di ka trabaho, if dili ka eskwela ang uban nga people sa household. So just isolate the one kid that's manifesting the symptoms, constant monitoring lang mo sa household sa other members of the family, and continue to do proper hand and hygiene na to.
Sa ako, Doc, dapat ba cases monkeypox for this year sa LLC?
So monkeypox was also a recent public health problem dito sa Cebu. In Lapu-Lapu City, for transparency purposes, we logged in a total of 2 confirmed cases in a span of 1 year. Our first case was actually back in 2024, and then we also had a confirmed case just in the first quarter of this year. And then the rest of the cases, we also had to identify and took samples from them, and luckily they came back negative. The problem with your mpox, it's very similar in terms of presentation. Sa current na to nga nag-spread nga variant diri sa Pilipinas, it actually presents similar to your chickenpox or your adult nga chickenpox or your shingles as well. So as sa medical officers dito sa Lapu-Lapu, it's also challenging how do we, skin problems in general for doctors can also be challenging. Kay one disease can also present like another disease. And that's like why I said in mpox, more similar sa chickenpox. And so far, buyag lang yun. Atong cases nga na tally and sent out our samples to SOTO or our ITM, ni negative raman yun. And to share lang po ato ang positive nga case, it was very na-shock lang po mi nga ni positive siya sa mpox kay solitary lesion lang diri sa iyahang palm ug diri sa iyahang forearm, which was weird kay ang atong I'm a recent passer nga doctor. I only became a doctor back in 2024. So dili pa kay wide ako ang scope of practice. However, reading from it in medical school, mao ni si monkeypox, and seeing it in actual patient, you're kind of saying nag-change na gyud ang kanang presentation. But again, it varies from patient to patient. But moto, we remind our health staff dapat high index of suspicion lang gyud ta. If we have suspect cases, refer to us kay we need to test them just to make sure. But so far, we've only had 2 cases, and then
Both recovered na sila.
yes, fully recovered with no downtime. Reintegrated na gyud sa ilahang work. We just have to be very sensitive with the information that's being spread because kahibaw na ta, medyo dali gyud mo, the flames of misinformation can get out of hand. So we ask the understanding of the public if we do not publicize the current health problem, because we need to, the health expert should be the one to first control and mitigate the case, and then if there is a need, we will have to spread it to the public. But since we were able to manage it, Raman said, so it's a system that works for now.
Sa katong duha ka cases, just going back, Doc, pila kay edad ani nila, and did they have any history of kanang immunocompromised sila?
So, not to be going too specific with the cases, no, because we need to protect the privacy of these patients. Ato lang po i-share nga, the first ever case in Lapu-Lapu was actually a child with no history of travel and no history of sexual history, no? So, very atypical. Dili gyud siya ang common nato nga usually ang mpox man gyud nato. Usually male to male, usually with history of travel to places nga na confirmed cases, immunocompromised, pwede pod. So it was again medyo nakuwan mi na nawindang nga this it's not your typical one, and we just really thought it was chickenpox because it really looked like chickenpox, and then the test came back ni negative, but we also had to test the household members kay nag chickenpox pod ang iyang brother, but then mayo na lang pod negative report. For the second recent case na to, it was a male patient around his 20s, and this patient has no travel history as well. So it just supports the fact that in Cebu province, Cebu City, Lapu-Lapu, Mandaue, the recent cases that we have been tallying are local transmission variants already. Dili na ni katong atong ginahisgutan nga gikan sa travel history, no? And possible po na atay component nga sexual history po.
Katong times na grabe jud kaayo nga alert ang mga tao pag monkeypox ba, kamusta dito, Doc? Like daghan bag ni adto sa center nya mga Doc, unsa day ning kuning ako ang butoy direct, Doc?
So again, just to be transparent, yes, daghan yun ang ni adto, daghan ang napraning, which is good. We welcome the mass speculation sa mga tao kay para pod atura, it helps us actually kay we don't have to go deeper into the field just to go there kay sila na iniduol na mo dito sa health center. But again, you know, we have done multiple na testing, and then buyag lang yun since atong last na nga case wala ra pod ni present. And also to share, kana mga cases nga mura na noog monkeypox were just chickenpox or shingles lang noon. So yeah, daghan yun ang niadto na nigurado lang, which is good.
But at least na answer sa ito ilang pangutana. Pag natabangan sad sila. Okay. I think later atong mga kauban sad sa media kay naghapay pangutana for the health department sa Lapu-Lapu City. From health, wala bang sa tourism. Atong i-welcome atong third guest for this morning again, Michael Espinosa, Accreditation and Statistics from Lapu-Lapu City Tourism Office. Good morning.
Good morning, ma'am. Thank you for having me.
karong buntaga murag ang center jud sa atong hisgutan is the preparation of the tourism office for the Ironman. Unsa na may mga initial nato nga naplanuhan in terms of preparation ani?
Initial lang muna na kuan ma'am, last June nag-start me og coordination meeting together with the Sunrise Events and the Office of the City Mayor. Then last yesterday prepare ang Lapu-Lapu City nga big program this coming August 8, which is after the Bulak na Run. So then meron tayong auction sa atong mga auction sa atong mga athletes and also sa atong mga artists. So actually nakita na nako na item ngadto si Kuya Kim nga for auction and also si Kinit Kobonkwe. So dala ko dito yung mga items. Then grabe ang preparation karon sa nag-create tag TWG. So tanan pati sa mga road kung asa dapit ang mga roads sa atong marathon karon ang gipang kwanto katong mga gipang kalot nga mga kalsada kung naaba so gipakuansa gipang tabunan kung naaman. Then for the sa atong city sa disaster na to ma'am kay prepared na sad siya. So naatay mga station nga gi-create near pod sa atong area. Then hasta pa atong mga police atong mga PNP police po. Na time nga gipang assign po nga kung asa dapit ang area sa atong marathon.
Nabay changes with the route sir or wala ra?
Wala ma'am, same ra gyapon last year.
For the past years, tamat sa nakahisgot magugag mga gikaut, gitabunan, nakahinomdom may pag-govern ng before nga napay mga dan nga marag napay lungag, gi-inspect ganito ni now Congressman Ahong Chan. So, kumusta man sir? Wala na tayo ani nga mga hazards?
Karon ma'am wala na. Gahapon na dito Monday. Last Monday is na dito ang DPWH which is wala na jud mga gipangkalot nga mga kalsada. So, ready na jud siya sa atong marathon sa atong Ironman 2025 po.
Pila may expected nato nga mo join this year, sir?
Sa atong Rina Bulak na ma'am, last na kon is 850 ka participants and for the Ironman so mga 1,000 plus.
Mas higher di compared to the past years?
Yes, ma'am.
Sir, just to clarify, nagsugod naman ang registration, ani no?
Yes, ma'am, nag-start na po.
Oo. Nana ba mga foreigners na ni register or mga ilado?
Yes, ma'am. Actually, 45 countries na ang na-register. But sa mga professionals is wala pa sa gihatag sa mga details jud kay ang nagkupot man gud sa registration is the Sunrise Events.
In general, unsay dakong impact sa tourism sa Ironman sa Lapu-Lapu since the start of Ironman before?
Actually, ma'am, this year is new, no? Before is naatay carbo loading, no, which is parang welcome dinner sa atong mga participants. But today is this coming August 8, so nagbuhat mi og part sa among coordination meeting with the Sunrise. Ang gusto nila is bag-o. So kung nakita ninyo last kadaugan sa Macta naatay community marketplace which is ang lahat tanang mga livelihood nga naay mga tinda sa atong Lapu-Lapu is gipatinda nato sa Mactan Shrine. Same sad karon sa atong kuan ma'am sa atong Ironman. This nag-start sa August 1 na open ang atong marketplace. So ang mga participants nato during August 8 is adto sila magpalit og food which is naa sila voucher gikan mismo sa Sunrise event. Then naapod tay gi-prepare nga dinner pod para po sa atong mga professionals and VIPs po.
Na natay celebrities nga pwede mahinganlan sir pa.
Wala pa jud sila gi-disclose na mo ang Sunrise events. Oo.
Unsa lay reminders nato sa atong mga athletes ug sa atong mga participants, sir?
Dapat lang ko ang reminders no dapat i-ready niyo atong self no. Kung dili na kaya at stop kay lisod na og maunsa ta sa dalan. Sa ato pong mga viewers, sa atong mga upunganos nga mo tan-aw karon sa atong Ironman is Ato ang likaya no ang paglabang-labang sa atong route kay basin madisgrasya niya pod ang atong mga athletes dayon. Sure ko daghan kaayo mong makita mga artista karon. So dili lang sa pwede i-disclose. So i-wait lang jud nato ang atong sunrise events nga sila mismo ang mo disclose or maybe ang atong Office of the Mayors ang mo disclose ana.
Paaboton sa atong mga
Yes.
kauban nga upunganon. For tourism, gihapon mo touch lang ko, sir, if nala ka idea about ang province of Cebu, Manggod, they are thinking right now or welcoming the idea of this Hallyu Wave or di ba mag-shoot. We invite international stars, especially Koreans, no, nga mo anhi sa Cebu, especially ang Lapu-Lapu, to shoot their films aron sad nga mahimo gani tang spot good for tourists. Nagkahisgot ng buana or is that a possibility in Lapu-Lapu?
Actually, ma'am, pwede na jud na siya kay Lapu-Lapu is welcome man kung kinsa may gusto mo shoot, no. Actually, last month nag-shoot nga to sila si Kim at saka si Kuan Paolo Abilino. So welcome jud kay ang Lapu-Lapu kay nga this is a big promotion man sad nga mo-promote ang Lapu-Lapu or unsa ang naa sa Lapu-Lapu.
Then asa tay data from the province and also sa tourism, Department of Tourism jud nga nagkaubos gid ang ato ang mga Korean tourists, which is my number 1 nato for the past years. Same ba ni sir nga murag sentiment diha sa Lapu-Lapu?
Yes, sa Lapu-Lapu, ma'am, ang among tourist jud karon dili siya same before after the pandemic. But this year is nag-anam na po siya Saka. No, then ang atong mga tourist spot karon like sa atong Mactan Shrine, grabe jud siya ang impact after the kadaugan sa Mactan. Actually ang atong total visitor pag last April after kadaugan sa Mactan is ni total siya og 11,925. Then in the month of May is ni saka jud siya to 13,849. So ang pinakadaghan ana ma'am isang atong international visitors. So kanang mga travels and tours ang nagdala dira sa atoa.
Or same gihapon sir, Koreans or unsay mga nationality ang daghan na ron may visit?
Natay ang daghan karon ma'am kay natay Koreans, then ang next is Japan. Yes ma'am.
Okay. To add lang siguro sir, unsay mga current and also mga gidevelop pa ninyo nga tourism spots and activities diha sa Lapu-Lapu nga paaboton sa atong mga viewers?
Karon ma'am ang planuhan to namo katong cave bitaw dili dapit sa may bridge. Oo, so dapat amo to siyang ikuan kay isa to siya ka highlight sad, no? And for the future nga mga tourist spot is kanang ongoing pa among mga meetings ana ma'am. Kaya ang among mga cultural o kanang nagsige pa man siya search sa among barangay.
But if ako sa turista, lokal nga tourist or international tourist, asa man ko angay mo bisita ko moadto ko sa Lapu-Lapu karon.
Karon ma'am mas nindot jud ato basta taho jud ang atong Kauhagan Island. Oo. Atong Kauhagan Island grabe jud ang pag-boom after the pandemic, no? So daghan ka siya turista kung gusto mo mga fresh na mga seafoods, mga live seafoods. So naara jud na sa atong Kauhagan Island.
Sir, sa kang Cebu Provincial Governor Pamela Baricotro, she mentioned about community-based tourism. Mao ni ang gusto niyang iduso, especially sa iyang administration. And how is that looking so far sa Lapu-Lapu City? Are we currently practicing community-based tourism?
Yes, ma'am. Actually, naga-train me sa among kuan, sa among each barangay. So ongoing this coming August 17 to 25, meron kami linggo ng wika and also the product of the Philippines. So ang mga product sa Philippines man naami karon mahimutang sa Pueblo Verde, sa Tamiya. So pwede mo maka-visit ngadto. So nadiha ang mga unsay gipasigarbo sa atong each barangay. Sama sa Basak na tay PC, sa barangay Punta Inganyo is the Kinason, and also the Olango Island ang atong mga seafoods.
So, thank you very much, Sir Michael. And sa uban nato mga viewers sad karon, pwede pa mo ma-ask questions sa ato ang mga guests. But before that, mga kauban, mo pause ta for a short break before we entertain questions from our friends from the media. Ato usap pasalamatan pagbalik ang ato ang presenters for today's forum. Thank you very much, Manila Bankers Assurance, International Marketing Group, Kaiser International Health Group Incorporated, Kaiser Medical Center, and Delos Reyes Optical. Of course, for our venue sponsor for this morning, thank you very much, Waterfront Cebu City Hotel and Casino. Mubalik ni, o gato ang paminawon ang mga tubag sa ato mga guest from the questions sa ato ang mga friends from the media.
Skilled professionals provide fast, high-quality healthcare services. Here are the services offered by Kaiser Medical Center in our clinics nationwide. To provide you with the best customer experience, Kaiser focuses on convenience and flexibility with its 24/7 online access. Kaiser Medical Center, your partner in health and wellness.
We come together to commit ourselves passionately to our 30M by 30 campaign with the aim to create 30 million financially educated families by the year 2030. Let's inspire and be inspired, learn and grow, and make a difference in the lives of many Filipino families. IMG is committed to educating and empowering 30 million families by 2030. Join our financial literacy campaign.
Mga kauban, you're still watching Open Line News Media Forum here at MyTV Cebu. This time, atong hatagan, o gigayon atong friends from the media to ask their questions. So, yung sang name and your network and their question. Thank you.
Good morning, John Kimbote from GMA Super Radio, DYSS. Sir Dennis, regarding sa atuang communication with other disaster team, labi na sa mga lagyong province, kanya I know ang disaster group is murang na sila one network, pero challenge pa ba gihapon ni sa atoa like sa mga lagyong lugar, mountain barangay, sa lagyo nga lugar here in Cebu province, like if need dili ra batanan na ay like equipment to solve like if ever na landslide or unsa kapaspas ang atoang communication with other LGUs in terms of disaster, Sir Dennis?
Thank you. Right now, it is a challenge. Right now we can communicate. Right now, in peacetime, the challenge right now is in a disaster event. When our cell sites are down, that is a challenge because there is no redundant communication right now at the province. So what we are going to do, we have three options right now. We have to go to the traditional radio. Number one, traditional radio using repeaters. Number two, we can go to satellite phones. And the third is, which I am trying to consider, is the portable Starlink. So these are the options that are right now on the table. The problem with the repeater systems, because right now it's nothing right now. So from the province side, so the construction and the installation of the towers and repeaters may take maybe 6 months. So that is the whole province. So we are right now considering the last option, Starlink. The portable Starlink. So because in times of disaster, when everything's down, usually in disaster and typhoons, it's sunny the next day, even hours after the so we can get a satellite feed for a more maybe communication with the province, so that the governor can have decision making on that kind of situation.
Is this an urgent matter ba ni siya, Sir Dennis? Especially hapit na ang mga rainy season na to or ang piling pag-abot sa mga bagyo?
It's an urgent matter, urgent equipment. So, muna siya karong istoryahan yun na siya. I even had a group talking about it, and maybe in a few weeks we can finalize it, and because as I mentioned earlier, September, October, November,
Ting bagyo.
the truck of the typhoons are going to the side of down to Visayas and Mindanao.
Sa imuhang paglingkod, sir, isip disaster head PDRRMO sa province, sa imuhang mga, like, how was it? No, how was the province in terms of disaster preparedness?
I mentioned that in one newspaper without holding back. It is really in bad shape.
Bad shape.
It's in bad shape. It's not disaster ready. No command center. No redundant communication. No. A lot of problems that we have to fix. And one thing is very good is that the governor is supporting that office right now. With all, as the support is really there. So this is a years of neglect, I've mentioned it, so they may take time really to build a very coupled disaster-ready office. So as I mentioned, we can respond on what we have. So even equipments, rescue gears, we have to procure. Because rescue gears have a time life. Mo expires na yung mga ropes, diba? So we're doing that procurement right now. We're doing. Nasa process na. So that's all.
Atong gibuhat ang tanan nun, sir, para ma-ready gid ang
Yes,
province.
almost every day we've been following that up. I met them yesterday. I will be meeting them this afternoon again to discuss the air ambulance.
Okay.
No, also the sea ambulance. These are urgent needs. I think the governor was able to expound on this matter about the urgency of some of these vehicles, especially we are in an island.
Yeah.
You heard stories about people very difficult from these islands to be transported with health emergencies. No? You heard the stories.
Thank you, Sir Dennis.
To add siguro, Sir Dennis, kaning air ambulance na to, ato gyud ning i-purchase or sir, nana ba initial plans ani si Gov? Kaya marag, last week, nag-guest man na mo si Vice Gov Socopod and he's very open about that. Pero kana ang budget and everything, feasible ba ni siya, sir?
Yeah, it's feasible. It's feasible. It can be done. But it will take time because, procurement has to undergo certain studies, especially high-ticket purchase. And it is very expensive. You just not get by it. You have to study it, what kind. You have to consult experts. So that's in the pipeline. We will do it. We'll try to do it.
Good morning, panelist. Queen from MyTV Cebu. My first question would be for our tourism office in Lapu-Lapu City. Sir, the Lapu-Lapu City government has slashed the environmental fee for local tourists from 100 to 20 pesos. So, aiming it to boost the local tourism. Kumusta siya so far, sir?
Yes, dako kayo siya og dako ka siya impact from 100 to 20 at actually daghan na kayong karon mo visit ug balik sa atong Olango Island. Before is katong naa siya 100 pesos nga environmental fee. Di gamay jud ang among turista local nga local tourists para sa atong Olango Island, but karon grabe. Puro pulibok ang atong during weekend, puro pulibok ang atong mga island hoppings dito sa ato ang Olango Island. Dako jud kayong pasalamat sa ato ang mayor nga iya jung gipaus-usan. Iya jung gidungog ang singgit sa katahon nga paubsan sa muta kong lokal, So mao tong si Mayor Ahong Chan before iya tong gipatawag ang atong mga operators, mga pambot operators nga unsa joy mga yangungo sa mga turista. So mao to nga paubsan daw ang atong environmental fee. So iyang gidungog, iyang gituman nga iyang ipaubos sa 20. Gikan sa 100 mato. After ato, grabe na jud ang ato ang turista, mga local. Dako na sad kayo ang 100, but ang ang 20 pesos dako na kay makatabang sa atong environmental. Samot na sa atong kadagatan. Kay mao po na siyang atong ikongod sa atong mga divers nga molimpyo sa atong kadagatan.
Any other plans or projects for the improvement sa local tourism, sir, sa Lapu-Lapu City?
For the naatay gibuhat karon na tourist rest area sa atong Olanggo. So dito inyong makita ang tanang mga products sa Olanggo Island, no? And sa mainland, so ongoing pa among meetings together with the team.
Another topic lang, sir. The DOT-7 in coordination with the Lapu-Lapu City government has launched a crackdown for tourist protection and scam prevention amid the reports of tourism scams. So, kumusta ni siya so far, sir? Doon na ba yung mga possible na tourist police desk available, if ever?
Sa Lapu-Lapu na atay tourist police nga na-assign na ata sa may Plantation Bay, napunta sa may Maribago. But to answer further, maybe our OIC will answer that.
Thank you so much. So, for our provincial disaster, sir, you've mentioned earlier nga magtukod mo og warehouses in both the north and south area. Na tay specific asa ni nga municipality or city, sir?
I'll announce it when I have finalized it. No, very difficult to preempt. No, we have to talk. I have to have site survey. But just imagine some place that is has a strategic advantage. If you say a place that can access north to the islands and south to the different municipalities, you have maybe that idea. But I just announce it once I have talked to the local executives and have a site on. But that is the plan of the governor. It's welcome development, especially to some who are responding, just to preposition relief goods in times of emergencies. So, okay na siya nga plano. It's a good idea of the governor. So, I cannot say a place yet, but there's already a potential place. I'll just announce it when I talk to them. I don't want to preempt things.
On the other hand lang, sir, we'd like to ask for your reaction as the new head of the Provincial Disaster Office. What's your reaction regarding the 1 billion unused funds sa disaster during the previous administration?
Yeah, it was announced by by Provincial Administrator Ace Durano. That's true. These are funds not used for the trust funds not used for the past 5 years, and the remaining amount annual budget for the year. So we will use it. You know, underutilization of funds, as I always been mentioning, is an indicator of inefficient management and governance. You program funds, you spend the funds judiciously, with accountability and transparency. That's how it is in government. You don't program and you don't spend. You program and you spend. As the governor says, we are not in the business of saving. We are in the business of spending judiciously, accountability and transparency.
For disaster officer, unsa yung top 3 priority projects?
Community command center, the communication, redundant communication, and the search and rescue gears. But there's still a lot. No, these are items that we can do in a short term. The sea ambulance, a lot of study, but we can do it. We can do it. If we can do it this year, we'll try to do it this year. And the air ambulance. No, we are not experts. We have to ask. You know, these are people's money. These are taxpayers' money. That it should be used with the way it should be used. That will benefit everybody. So we are trying to do. Sige mi ko ani ma'am. Sige mi working, studying, asking, because it's a high ticket project. You know. So you should understand. But we'll do it. We'll do it. If you can do it the fastest, the better.
Thank you.
Hello, good morning everyone. I am Marlon Ado Jr., intern sa MITB from the University of San Carlos. And my question is directed towards to Sir Espinosa. Sir, can you share some details about the overall safety preparation for the Ironman, especially karon nga grabe ang kainit sa panahon?
Naatay gi prepare nga water station area, no? So atong gitap ang atong City College nga may mo hatag og mga water sa atong mga sa atong mga participants. Then ga-deploy pud ta sa atong DRRM kauban with sa atong ang Sunrise pod na pod sa ilahang medical team po.
Pila ka estimated nga mga water station areas ang ibutang nato sa concert?
Actually, sir, ang atong ibutang water station area is from Mactan, Barangay Mactan to Barangay Suba-Basbas. So more or less mga 20 ka stations.
Thank you.
Good morning. My name is Teresa from my TV Cebu. My question is directed to Dr. Vincent Montejo. Sir, about sa health card, saan niyo siya pag-avail?
So, actually, health card, just to share to everyone, it's a documentation that a soon-to-be worker has to get para medically fit siya para mo to be employed or to work in different fields like food-related or really food-related. In Lapu-Lapu City, we actually have a post about it in the Lapu-Lapu City Health Office na page. So you can direct yourself at it dito sa ato ang FB page. But basically, it's a rundown of ang kung requirements imong gipangutana, ma'am, we do need laboratories, basic laboratories such as your CBC and urinalysis. But if the patient, if ang atong worker is food-related, we have to get other food-related nga possible diseases nga screening like hepatitis A, hepatitis B nga screening, also all of these other requirements that is actually posted in our FB page.
Sir, do you think maka-help ni sa speed sa services sa Lapu-Lapu?
So, ang health card, yeah, definitely. So, this is a way of a quick screening whether or not they have diseases or certain nga mga sakit nga angay bantayanon in the workplace. I have had multiple patients nga wa na ko gipirmahan ang health card tungod nga naay problem sa X-ray or problema sa ECG. So it's a quick screening process, and we do admit that we cannot manage them tanan sa City Health Office. However, we do direct them to capable medical specialists para sa uban nilang health concerns. But if kaya ma-manage sa City Health Office, we definitely do those already.
For my second question, sir, about sa mental health clinic, ipadayon ba ni sa inyo sa LLC?
So, in Lapu-Lapu City, just to share with you, we have coordinated with the Mental Health Association, the Reyes Cebu, with specialists from the Center for Behavioral Sciences nato sa Vicente Soto Memorial Medical Center, together with our local LGU. We also have a coordinator with the City Health Office, Ma'am Waisel Zolio, together with the supervision of our City Health Officer. Makaingon gyud ko nga we actually received an award regarding our mental health services tungod nga we are basically championing the mental health services sa city. We have medications available for our mental health problems. It started out as a once a month clinic together with the specialist from Soto. Nahimo na siyang twice a month, which is also good. We also have extended these services here in certain months nga we do cater to our island constituents sa Ulango and also sa Kauhagan and sa Panganan and Kauban. Just to reiterate, we have existing mental health services sa Lapu-Lapu City. We have twice a month consultations and we have free medications provided for our patients.
Last question, sir. Since we're talking about mental health naman, so is LLC Health Office prioritizing mental health aside from the other health concerns?
I would say so. The award that was given to the office was also a testament that we also prioritize these patients, and we have actually seen improvement in our patients nga, you know, we do see these patients from in our day-to-day nga kanang mga what we term buang in the streets. You just give them the proper intervention, the proper guidance and medications and consultations, and they will return to their normal daily lives. And we have seen improvement in the reintegration of these people. But dako lang suporta ang need nila, and that doesn't necessarily come solitary from the City Health Office. It also has to come from sa ilang families, no? To help them go to the consultation, mag-follow up sa among mental health clinic, to get their medications on time, or magpa-inject sila sa need nila nga medications, and also to follow up to their specialists if needed. And we have been doing that together with the help of the administration.
Thank you, sir.
So, good morning everyone. I'm Nicolas Malaga from the Freeman. So, I'd like to ask first Mr. Dennis Pastor of Cebu Province PDRRMO. So, you've mentioned earlier na bad shape ang status sa atong response sa Cebu Province. I would like to ask follow-up, how bad is it?
This is when I assume. So there are changes right now. While there's still an uphill climb in terms of equipment and capability build-up. So I mentioned earlier that you see in the newspaper we only have 3 responders before when I assume. Right now we have additional 10. So we have 2 teams that we can deploy. We are starting to develop or establish the command center. Before there was no command center. It's so bad shape. And there's no redundant communication right now. I mentioned earlier that we're trying to venture in some things that are more feasible and practical. There are 3 options that I mentioned. So we're doing right now the procurement process. It will take time, but it's not an eternity. On terms, the procurement process is there to protect the interest of the taxpayers' money. So we have to we have to follow the process. Dili ni siya kada mo ato tag pharmacy palito by Jessic. No, it's not that case. You have a process. You have to check. You know, there's a study. So when I assume it was that, right now we're improving. Once we get the procurement done, then we'll be improving.
Okay, so with Governor Pamela Baricuatro sa ihang term karon, and with you as the new head sa Cebu PDRRMO, what can you promise sa atong Sugboanon nga from bad shape mahimo siyang good shape or mas maayo better shape gyud?
Going to be a disaster ready unit. That's what I'm going to promise. Disaster ready, that can respond and that is prepared.
Okay, so another question, sir. Pag yun akong gi-prepare. So, what incidents ang mostly nagi-respondihan ninyo sa PDRRMO across Cebu Province? Like, if you could mention just top 3 lang.
The hazards right now are flooding. So, we are trying to procure flood boats. No? We are training also the new responders in terms of the addressing water rescue. When right now typhoon is this is the typhoon season basically. You have seen it in the north. So we have to ensure also, I discussed earlier, our responders. These are because you know it's very dangerous. You know, you order them to go. You don't know what, you know. There are a lot of things and hazards in that kind of job. So to ensure them. So I'll talk to some providers on that.
Okay, last question for you, sir. So, what is your urge or panawagan sa publiko nga when it comes to disaster responding, considering that most people ang una nilang buhaton kay mag-upload sa social media, like mag-live, or na before sila manawag o responders?
Social media also does help, but it should be about responsible posting, no, responsible vlogging. Na iban mo, when there was a landslide, somebody posted a landslide that occurred 3 years ago. That's bad. You create panic in there. So just be truthful in terms of when you're asking about social media, just be truthful and okay, just be responsible and truthful in your post, especially those in those social medias here in right now. Wala mi sa una karon ko na kayo, di ba? Maron akong advice in terms of when you're asking about social media.
Okay, dagan salamat sir. So now I'd like to ask Dr. Montejo. So Doc, mangutana ang tako bahin nga kanina you've mentioned about dengue cases. So ni-increase, di ba, from 331 last year to 448 this year. Clarify na nako, are these in the same period, like from January to July?
Yes. So the data I mentioned was in congruent yun siya sa unsata last year around this time. So 331 last year and 448 around this year.
Okay, so di ba nisaka siya? So what are the factors nga inyo nakita sa pagsaka sa dengue cases this year?
Okay, so just to share with you, dengue is again an endemic problem year-round, no? And we do see cases of it musaka gyud tungod nga daghan og catch basins of water, mostly during the rainy season. So magka-expect gyud ta as the year rolls by, especially padong ta and sa atong summer season, magka-increase ang cases. Atong factors gyud makita is environmental gyud mainly because our main thing to do with dengue to control the cases gyud is vector control and management, which is more on search and destroy gyud ta, which is pangitaon nato ang possible places nato nga habitat sa mosquito atong pugsaon. But as we know, daghan kaayo tag empty water bottles sa mga sari-sari stores. Stagnant water nga gihimong labayanan sa basura. So among a few of the very many places kung asa pwede manganak ang lamok. Aside from that, ang kanang saudanan ninyo sa plato sa inyong panimalay, ubos sa inyong mga ref, anything na naatay micro droplets of water, technically it can be a source of nguyong-nguyong nga mo puyo dito and become a mosquito that can be infected with dengue nga makakos og dengue. So definitely ang number one nato nga problem is environment, and balik-balik lang gyud ta nga remind sa ato ang constituents, mga tao nga in order to avoid these diseases, kay dili ra man dengue atong ginaatiman for mosquito-related nga mga sakit. We have Zika, we have chikungunya, we have malaria. If atong patyon ang manok, ang lamok, if we kill the mosquito early on, we won't have problems with these diseases later on. No, if we go to the root of the problem, and really environment bang yun ang root sa atong problem. But we do see nga medyo kulang pa po sa disiplina ng mga tao, very dili mulihok unless naatay clustering of cases, which should not be the case at all. Dapat pa lang kung naamoy i-store nga mga empty bottles sa inyong soda, dapat nakataob, or dapat if naamoy nag-accumulate mo rainwater for the use sa pag-water sa inyong plants, it should be covered. No, so all of these things can help the community at a larger scale. Good.
So katoy mong gi-provide nga data ganina Doc kay from first quarter of this year. So is there a possibility nga musaka pa jud ni og maabot to ang inyong gi-expect before?
So yeah, definitely naagyud tayo possibility of the dreaded nga spike of cases. Again, we were around 1,234 cases around this time pag 2022. We expect it to rise in 2025, but with the trend na to nga nakita karon, it doesn't seem nga moabot tag 1,000 cases, which is good, no? However, as we're not gods, so dili ta kaingon patiwas, no? So we still have to be very prudent with our reminders sa ato ang mga katawhan to be vigilant and not be complacent, kay complacency will affect us kung dili nato ni atimanon pa lang walay controlled atong cases. But buyag lang yun, our cases are very controlled. We tally daghan na ang 10 nato per week recently nato. It's always single digits nga atong natala every morbidity week nato nga reporting from the City Epidemiology Surveillance Unit.
Last lang, Doc. For the record, do you consider this so far as alarming or not?
So again, I have to talk about the latest data in association with the data that we have before. Based sa atong data before, it's not alarming. Kay kung we are looking at the spike cases na itong expect every 3 years, that would have been a different story. But currently, this is not, it's a health problem, yes, but it's not a immediate nga health problem or concern that we should kana bitaw magpanic na ang mga tao. There's still things to be done, dili magkumpiyansa, but it's not a panic level, kumbaga mao to imong where you were getting at.
Okay, daghang salamat.
Good morning. Hello. Good morning, sir. Mabuhay. So, ano siya? Pwede nandun na lang mag-mic. Pwede ito. Ay, passes. So, no. Thank you. I would like to ask from the Lapu-Lapu City Health Officer, Dr. Vincent, with regard gihapon sa dengue, but this is different. With this 448 new record cases this year, sir, I would like to ask if okay ra pud mag-ask no kung asa nigi ka na barangay mostly ang contributor aning positive cases, sir. At 5 lang siguro.
Okay.
From the top 1 down to 5.
So on the top of my head, top 2 na to actually. We don't base mangyud number of dengue cases. We have to also base it with the population sa barangay.
Okay, sir.
So actually Barangay Tinggo, island na to sa Olango, and also Barangay Kauhagan, top 2 na to.
Okay.
Our attack rate, gamay ramang gud ang population, and we have multiple cases of dengue. Just to share, recently may niadto sa Barangay Tinggo kay we had to do entomologic survey to assess if pwede na ta mag-misting dito balik kay daghan kaayo cases. And just to remind the public, ang atong misting efforts, dili na siya dali-dali nga ganahan magpa-misting si kapitan, we have to do it. We actually still have to do studies para makahibaw if effective ba ta nga mag-misting diha nga area. So Barangay Tinggo, Kauhagan, we also have Basak, which is the largest barangay nato diri sa Lapu-Lapu. We also have Poblacion, Barangay Poblacion, and Barangay Paho. So more or less those are the top 5 barangays nato diri sa Lapu-Lapu City in terms sa dengue cases based sa population.
Okay, sir. A follow-up rasad question, sir. Kanang, do you believe that these increased cases implies with the solid waste management of the public, sir?
Yes. So, like I said earlier, environment man gihapon ang main problem nato diri sa dengue. More dengue breeding mosquito breeding sites, more chances of getting dengue. So not just solid, but I guess also other waste management nato nga efforts also have to come into play para ma-control gyud nato ang ato ang number of cases year round.
Okay, last question, Doctor. About sa katong impacts bar chicken facts, ako lang pong untang i-clear out ang information nga kasagaran na atong public nga myth ba ni siya or true nga kanang once ka-experience na kaana nga disease kay dili na ka matakdan, how true or how false it is, sir? Doc.
So that's definitely false, no?
Okay.
And I think you're pertaining more sa chickenpox.
Chicken.
So I think si chickenpox good, once you're exposed when you are younger, there is a very little chance for you to transmit it or get the adult version of the chickenpox or your herpes zoster nga infection. However, dili gihapon siya prerequisite nga dili na ka makakuha aning sakit inigdako nimo. Magdepende na if you are medically healthy, if wala kay other immune problems. We have seen patients nga nagka-chickenpox na before tungod nga na ay let's say HIV, nagka-shingles gihapon sila paggadako. For mpox noon, we do not see the trend nga na I repeat nga nakuha kag mpox before you will get mpox. If viral mangyud ato ang sakit, there is our immune response will actually recognize a previous infection and help your body prepare for future infections. So, ang punot dulo ana is less likely, but it's not kuan yun nga dili na magkasakit in the future.
Okay, thank you, Doc.
Hello, good morning. I am Miles from Radyo Pilipinas intern. My question is to address to Dr. Vincent. Doc, may buntag. Sige, malay alas sa gamay, Doc, ha. Since they're talking about katong dengue, arisad ko sa katong giingon sa DOH. So, the Department of Health ngayon tabang sa local government unit o sa health workers alang sa nationwide bakunahan sa mga bata. Per in, nag-target sa laog 95% vaccination rate sa 2 million ka mga bata batok sa mga sakit nga malikayan. So my question here, Doc, is despite the challenges nga unsa pay dagdag action nato ding dapita sa Lapu-Lapu City Health Department og despite the challenges na naagyapoy mga parents nga nabala ka sa kaning vaccination or nahadlok ba nun, Doc? Thank you, Doc.
So it's really more on the ground work and information drive. There is still so much to be done in terms of catching up for immunization records nato. Perting layo gyud ta sa 95% sa tinud-anay lang. We are also seeing the recognition nga nagkabalik ang atong uban vaccine preventable diseases. Pasabot katong mga sakit nga dili nato madunggan sa una, nagkaanam-anam og balik because of the flames of misinformation, no? Nakita nato no katong I was still college back then katong sa atong dengue nga scare. Just to share also with you, atong dengue is also dako unta atong tabang diri sa ato ang country if we were successfully rolling out the dengue nga vaccine. However, as what we all know happened, nahitabo nga it became a big problem. So and also the recent nato nga pandemic with the COVID vaccinations, it also mas nagkabadayon ang misinformation compared sa kanang sakto nga pag-atiman regarding sa health information. On the record, vaccines that are being rolled out by national agencies, by your local health centers, are safe and effective. These will help prevent vaccine-preventable diseases like tigdas, polio, among others. It will give you added protection. It does not necessarily assure nga di na ka magkasakit aning uban nato nga mga sakit. But like what happened before with COVID, if you are afflicted with it, dili na severe ang disease nga makuha nimo. So vaccines are still effective and can help yun. However, makakita gyud mi karon nga although we have mothers who voluntarily go to centers to have their kids do their routine immunization, we still have to do catch-up immunizations kay nagay mga mama nga sometimes busy, sometimes mahadlok, sometimes dili ganahan mo atog health center kay also doing livelihood, no? So in coordination with the DOH, we actually have our on-the-ground program nga there are certain days that we go to recorded nato nga patients na need na og follow-up o kanang catch-up vaccination. So kami na mismong niadto nila, no? So these are one of the many efforts nga ginabuhat nato para ma-recognize na ang goal nato sa DOH nga immunization nato nga goal, which is 95%, which is quite layo-layo pa gyud. But we are slowly getting there.
Thank you, Doc.
Thank you very much to our friends from the media. So I think, sir, nakikasyon, sir? Sige.
Good morning, Richard Alpahura, DWSM. Dok, mangutan ako ni mo, Dok. Unsay view ni mo, naman ko yung mga anti-vaccine advocacy groups, no? Nga, they are thinking naka-deprive ni silang liberty. More, ilang concern ang natural immune system lang i-work out sa itong human bodies.
So, some of the things that these anti-vax groups are saying are not totally wrong naman sad, no? Immunity-wise, our body is well adapted to, fight off diseases or certain vaccine-preventable diseases. Ang kwan lang ginato sa vaccine is it gives you an inactivated virus, kumbaga, let's say, with polio or like atong penta o ba natong vaccines, they give you the inactivated virus kay para ma-expose ka to to that virus nga dili makaapekto sa imong lawas. Kumbaga, exposure to that virus will help your immune system develop recognition for it, kay para in the future nga ma-expose na ka to the actual thing, dili na severe ang pag-atake sa imuha, kay na-expose naman ka with the inactivated nga virus, which is the main component nato sa uban nato nga vaccines. Of course, we have different types of vaccines, but that's the gist of it. Nga naatay inactivated virus, it will help your body nga mo na bagihatag sa imuhang lawas diretsyo. Ang problem mang good nga, you just depend on your natural immunity. When are you gonna get exposed to that virus? And will it work in your favor ba? Nga, for example, we have seniors, daghan atong seniors nga medyo anti-vaxxers, no? If they get PCVs or kanang atong a pneumococcal nato nga vaccine, it helps them prevent, not prevent, but help them boost their immunity for future infections, especially pneumonia, no? Or ato ang pneumonia. So, since seniors very high risk for pneumonia, it's prudent nga mahatag ang ani nga type nga vaccine nila kay para kung actual thing na yun, dili kay as grabe. I hope I'm making sense, sir. Sa akong pasabot.
So, kanang observation ba, di ba doon na yung mga cases nga katong mga labi na mga seniors no nga dili kay comfortable kanang mo suffer ng sa trauma kung magpa-vaccine sila, kanang unsay possible respond sa community ana nga maong mga concern kay para magud nila more attune sila sa natural nga process sa human body, iyahang mulihok nya. Doon naman ko'y aware siguro ka kada mga conspiracy theorist nga nigawa sa social media. Unsay imuhang respond sa mga nang lutaw sa social media nga conspiracy theory?
I definitely disagree with them. If anything else, I would like to say trust the experts. Trust the people who have studied these for years, have studied the efficacy of the vaccines, their contents, and not necessarily believe social media posts with no citable resources sa ilahang literature. No? The thing is, kaning mga vaccines, they have been studied by the manufacturers nga nagkuhan, they have been peer-reviewed, they have been reviewed by the agency nga mo roll out aning mga vaccines. So, but I would also like to recognize nga naagyud tay mga possible nga complications aning uban, but it's a very minor percentage. Naarata sa single digit nga percentage out of the 100% nga possible complications, and that's just possible. Most na to complications aning mga vaccines are just mild nga fever or mild nga prodromal symptoms like body malaise, no? But definitely I would dismiss kaning mga conspiracy theories about, you know, it causes sa mga to kung mga common nila, it causes autism, it causes infertility. So these things are definitely not true.
Reduction sa human population mo nang gimini mo, no?
Yes.
Ari na kumutana ni sa Kauban province, no? Kanang long term para sa tulo ka tuig ni Governor Pam sa kanang iyahang disaster reduction program. Sir, nya ikaduha kanang dili ba kanang risk concern kadungog ko nga usa sa facility nga buhaton anha ibutan sa kampo ang kanang murag sana education center kanang usa response mo ana nga mong pipila ka concern?
Long term is community-based disaster risk management. That's a long term. Readiness in terms of equipment, short term. If you want, let the community know they can manage their disaster risk. You need a lot of capacitating, a lot of buy-in on that idea, a lot of empowering the community. So we will be partnering with some non-government organizations for this. So money long term, this should be a kind of when you change the mindset in the community. It's very difficult to know the risk, to know how to respond, and how to transfer that risk. May I know the second question, sir, about
Kuan kato bitong evacuation center nga suppose anak sa kampo ibutang di ba na anak or dili ba na mo provide siya og security risk sa state kanang anak buhaton diya sa Camp Lapu-Lapu sa Apas
Renovation.
Oo. Wala concern anak nga magimo kuan. Evacuation center.
No. Evacuation center.
Oo, dili evacuation center.
No, it's just ang plano na sa the Camp Lapu-Lapu, by the way, the commander met with the governor last week on that issue. There's still a issue on the lot. No, it's a muna siya dako ang issue. Ang plano din is just to establish in the future the command center inside Camp Lapu-Lapu. But it will, I hope we can solve it the sooner. No, kay I don't know the legal kanina kay about the lots. But these are concerns of the tenant units, the armed forces that are staying in there. Have you visited lately? Camp Lapu-Lapu? Kano siya kay because there dispute, not a dispute, but there's a problem of are they really getting out or not? Diba? Yeah. So it's a provincial property, by the way. So ang establish ng command center lang. And if we can use still the open lots for our helicopters and for relief operations. Na siya eh.
Yes, sir.
Good morning po. Jean Valenzuela from New Star Philippines. Sir, concern ko lang since you were talking about camp, there are a lot of buildings newly built by the commanders of the past commanders of this central command, but was not given any permit by the provincial government in order for them to have this electric installations sa mga buildings sila. So it needs the approval of the governor. Ano pong take nyo about this?
I think I'm not in the position to answer that. Although I know some ideas, but maybe you can ask that question maybe to those who knows the situation of those buildings. You mean the buildings that are being erected that are used? I'm not in a position really to answer on that issue. You can address that question maybe to the provincial administrator.
Another question, sir. Since you were mentioning about this long-term plan of your program sa disaster risk management, unsay mga challenges nga do you think nga ma-encounter nimo in implementing this program?
Yeah, when you organize communities, a lot of changing attitude, changing behaviors of the communities. That's and the buy-in about understanding disaster risk. No, moabot kag community lahi ba ang priorities. And when you change the priorities or maybe just part of the priorities in disaster risk, it takes a lot of time. No, it's not easy. I've seen it that they have really changed the attitude, but still, changing behaviors. And there are NGOs right now that are addressing it, and we are trying to tap their partnership with them. I'll be talking to them within this month, maybe next week. What about the budget? Budget for community base? There is. We have programmed that for next year. That's the priority that I have discussed with my team, that we should go to the communities. They should know. They should know. Not only PDRM knows the hazards or the risk, the communities. Even in the schools, we have projects in schools to know the risk also. And they know how to respond also. It's just changing attitudes. It will take time.
Another question from Greggy Magdadaro of XFM. Muragi, insert lang niya, sir. How ready is Cebu sa pag-respond kung simba ko lang na linog? Because of the linog sa nanganigo sa other countries. Kita diri simba ko lang. Kung saan man ta kaandam, knowing mas daghan man ang preparation sa pagbaha and everything.
Our local disaster risk and management office in the LGUs are also equipped. No? The protocol right now is that when the incident happens in one municipality, that local DRMO responds to it. If it affects 2 or more, the provincial DRMO responds to it. What is very important in this, in that eventuality, really how fast we can get the situation. What is really our awareness of this way? Very difficult to deploy resources we don't know. So one of the projects of PDRMO is really to get some unmanned vehicles, drones, to get real-time mapping of what is happening on the ground. I've been talking with some providers on that. Importante na siya in terms of situational awareness when that incident happens, so that we can decide on what to do.
Any more questions? I think okay na ang ato ang media friends. So at this juncture, we would like to give an opportunity sa ato mga guests to give their closing remarks for today's forum. I'll start with Sir Michael.
Thank you for having invite lang tamo sa this coming August 8, 9, and 10. For August 8 is the Reyna Bulak na Run. August 9 is the Iron Kids nga ato ipahimutang sa Dusitani. And August 10 is the Ironman 70.3 2005. No? Mag-start siya at 5 a.m. So, sa tanang mga upunganon nga mutanaw, so mag-enjoy ta ninyo og atong i-cheers ang atong mga participants. Thank you.
Thank you very much. Doc Montejo.
I guess it's just to reiterate that we have existing health services, especially in Lapu-Lapu City. So go to your nearest health center if you have any other concerns, if you have any other queries regarding your state of health, especially if recently exposed ka to floodwaters, or you have concerns in your community regarding rising dengue cases. So please coordinate with the local health center. We have existing services for these problems.
Thank you for inviting me. And I admire the mix of resource speakers right now. Disaster risk, health, and tourism. These three are really connected. When you have an influx of tourists, it affects the environment, it affects waste management, it affects power, water supply. And also in health, it's also connected with disaster. When you do have evacuation centers, there are diseases that are spreading during the... So that is all I would like to thank you for this mix of, good mix of resource persons that are really related. Thank you also for inviting me.
Thank you, sir. Again, we would like to give our warmest gratitude to Sir Michael Espinosa, the Accreditation and Statistics in Lapu-Lapu City Tourism Office, and Dr. Vincent Jess Eduardo Montejo. Thank you kayo, sir, Lapu-Lapu City Health Office, and Sir Dennis Pastor, the head of Cebu PDRRMO.
And daghang salamat to all our viewers nga nagtanaw karon sa Open Line News Media Forum. Next week maguban-uban sa lain na pod nato nga episode. But before we end, I would like to thank again our sponsors and forum presenters for today's forum. Thank you very much, Manila Bankers Assurance, International Marketing Group, Kaiser International Health Group Incorporated, Kaiser Medical Center, Delos, Reyes, Optical, and of course our venue sponsor for today's forum. Thank you very much, Waterfront Cebu City Hotel and Casino. Once again, thank you very much, mga kauban. This has been Angelica Faisaniel
and Eliza May Piñaranda.
See you next week again sa lain na po natong Open Line News Media Forum. Good morning.